We should be ready.
And we are live.
All right, good evening again. We have a quorum. I would like to start with Jimmy, our, Vice Chair Paul Mary leading us off in the Pledge of Allegiance, or leading us with the Pledge of Allegiance.
I pledge allegiance
To the flag of the United States
of America and to the republic which it stands, one nation, indivisible, with liberty and justice for all.
Okay, thank you, Commissioner Paul Mary. And Dee, may we have a roll call, please?
Commissioner Byers,
Here.
Commissioner Darvish,
Present.
Commissioner Freiberg,
Here.
Commissioner Meltzer,
Here.
Vice Chair Paul Mary,
Here.
and Chair Davis.
Here. Thank you.
Let the record note that Commissioner Shendrick has not arrived yet.
All right. So the first item up is an approval of this agenda. I need a motion to approve and a second, please.
I'll make a motion.
Second.
Been moved by Commissioner Darvish and seconded by Commissioner Meltzer. Is there any discussion? If not, Dee, may I have a roll call vote?
Commissioner Shendrick just arrived.
I see that.
So Commissioner Byers,
Yes.
Commissioner Darvish,
Aye.
Commissioner Freiberg,
Aye.
Commissioner Meltzer,
Yes.
Commissioner Shendrick,
Yes.
and Vice Chair Paul Mary,
Yes.
and Chair Davis.
Aye. Okay, thank you all very much. And then I would like an emotion and a second for the approval of last meeting's minutes unless there needs to be any changes. Is anyone looking concerned about changes? So I still need a motion and a second.
So moved.
Second.
Okay, been moved and seconded to approve the minutes of last meeting, which would have been August the 10th, which was, if anyone remembers, a 3-hour-long meeting. So, Dee, may I have a roll call on them again, please?
Commissioner Byers,
Aye.
Commissioner Darvish,
Yes.
Commissioner Freiberg,
Aye.
Commissioner Meltzer,
Yes.
Commissioner Shendrick,
Yes.
Vice Chair Paul Mary,
Yes.
and Chair Davis.
Yes. Okay, cool. We're moving right along. And I do have up as public comment. You said I had someone who wished to speak to us.
I am seeing one hand so far
I do
from,
see. Okay, I see. He's in my corner over there.
from William. I'm so sorry, William West. I do not want to say your last name wrong.
That's good enough. Thank you. Hey, good evening, commissioners. My name is Wes Sigmuler. A lot of you know me, but just for background, I'm a longtime West Hollywood resident, and I'm a HIV service provider as well as a community organizer for vulnerable populations, including sex workers, people recovering from substance addiction, and many other populations that are like, just like it's really hard for them to come to these local government sort of boards. So that's sort of how I see my role. But I'm really just speaking for myself tonight. So this is really hard for me to do, but it's really important that Mr. Palmieri, the vice chair of this commission, is brought to heel for comments he's been making over the last few weeks. I really have a lot of love for Jimmy. And I still remember how he helped me get through a really difficult domestic violence situation that I escaped with a lot of compassion, non-judgment, and understanding. And I will always appreciate him for that. I also really appreciate his decades of service to the cause of destigmatizing HIV positive people and people using substances, and harm reduction, and building services systems that West Hollywood City is an example for the rest of the entire country. Thank you, Jimmy. So on that note, because I have so much respect for him, that's why it's so painful and, quite frankly, frightening to see the way that Jimmy Palmieri has been dehumanizing people based on their vaccination status. I submitted a complaint to the city attorney a few weeks ago after addressing him directly. And the city attorney, from my understanding, while they didn't find any violation of the law, we want to respect public officials' right to free speech. And on issues of vaccination and public health, commissioners of this body should have an opinion. However, it is completely wrong. It's immoral and it's disgusting to see what Jimmy has said about people declining vaccinations or people that are unable to get vaccinated for medical or religious reasons. Calling them, off the top of my head, some quotes, human petri dishes. Those are his words, human petri dishes. He called them killers, selfish imbeciles. So tonight, I know you're getting a presentation on the updated, policies for this type of thing for public officials. And so I'm really curious to stick around for that and see what the updates are, because there's a lot of gray area in this new world we're moving into, right? But whatever the letter of the law is, we need to think about what the real world impact is of the vice chair of a commission tasked with serving all of the West Hollywood residents and visitors, ensuring that they have equal access to health services, that they're treated with dignity and respect. I think you can imagine what the impact is when we hear the vice chair dehumanizing us.
And we need to keep that.
Vilifying us.
I'm going to jump in real quick and need to keep the public comment to 3 minutes.
Yeah, I just looked at my 3-minute clock. I'm sorry, Wes, but that is part of what we do. But we did receive your message. So thank you.
Thank you.
Hang around, we're here.
I will.
And then I see Dean
Ambrosini.
Yeah, thank you for saying that.
Off the tongue. Hello, everyone. I'm Dean Ambrosini. I'm with the West Hollywood Project and the Institute for Public Strategies, and I'll keep my comment brief. I just am making an announcement that we are beginning late this week launching a fentanyl awareness campaign. As you have seen in the news, there have been some high-profile overdose deaths related to fentanyl. It's an increasing matter of concern within all counties, certainly Los Angeles. I recently moved from San Diego County, and the impact down there has been severe. And the high-profile overdoses, unfortunately, are the only ones that make the news. And I just wanted to bring it to the attention of the commission in the hopes that the city will join in increasing awareness about the severity of fentanyl that's showing up in many street drugs, most of them poorly manufactured. All of them have the potential to contain a lethal dose in just one tiny little pill. And I think it's important to increase resources for fentanyl test strips, Narcan resources, and other harm reduction programs. At the West Hollywood Project, we are eager to continue to disseminate information at that. We're the prevention provider for SPA 4, which is where West Hollywood lies. And most of our work is centered around reducing meth-related harms. However, fentanyl is showing up in every drug, including meth, and it's just not a problem that we can ignore. So I just wanted to bring it to the attention of the commission and look for our campaign on Facebook, Instagram, and Twitter. And we hope that everyone will join in following us. Our pages are the West Hollywood Project on both Twitter and Facebook. And thank you very much.
All right, thank you, sir. Okay, going to move along to unfinished business. This is the social service contract renewals. David?
So good evening, commissioners. I'm David Juney. I'm the manager of the city's social services division. And this evening, the Human Services Commission will consider recommending that the City Council approve renewals of social services contracts for the third year of the 3-year funding cycle, which begins October 1st, 2021, and goes through September 30th, 2022. So I'm going to walk through this a little bit. I know this is the first time for, I believe, 3 of the commissioners who've been at this point in the contract cycle. So I wanted to walk us through a little bit, and then Derek's going to join in for part of the report. So as I mentioned, the City of West Hollywood is entering the 3rd year of this 3-year cycle of contracts. So even though it's a 3-year cycle, that we have to come back and get an annual renewal. It's not a given that the agencies will have the contracts for 3 years. So we come back each year to recommend that the contracts be continued, and we come first to the commission and hopefully get your approval of the recommendations, and then they will go to council on at their next meeting, September 20th. So the City Council approved a total of $5,179,267 in general funds for social services contracts in their overall budget process for fiscal year 22. That's the one we're in right now. This time around, they did include 2% COLA. If you recall, for the commissioners that were with us last year during COVID and due to the impacts of COVID on the budget, it was the first year that I can ever recall that the city did not provide the 2% COLA. It's back in there. So it's a 2% on the base amount for the contracts. In fiscal year 20, now I'm going to walk back a little bit to the first year of this 3-year contract cycle. So in first fiscal year 20, the City Council approved a total of $5,077,713 in general funds for social services contracts in the original budget approved for the start of the fiscal year on July 1st, 2019. At the direction of council, staff returned with recommendations for supplemental funding in September and added $357,939 in supplemental one-time program funds for the social services contracts being approved to start on October 1st, 2019. These supplemental funds were distributed to 9 of the 38 programs with contracted social services agencies. The one-time supplemental funding was also provided, well, in addition to the social services, the city provided one-time supplemental funding for outreach and marketing by contracted agencies and by the city. And in addition, the additional funding went to transit programming, which expanded the city's Metro Bus Pass program to a 100% subsidized program. So due to the continued impacts of COVID-19, the city staff is proposing to extend the supplemental funding for an additional contract year, the one we're entering, 2021-22, to 7 of the 9 original social services programs. The city anticipates that contract savings from fiscal year 21 will be available to support the additional contracted services, and staff will report back to the Human Services Commission and the City Council once the current contract term is completed to explain how those funds will be reprogrammed. So the contracts for the 2021-22 year provide services intended to allow people to remain independent in their own homes and to improve their quality of life. It also provides essentials such as food and shelter. The funds address public health concerns such as COVID-19, untreated mental health, HIV and substance abuse through a variety of outreach and education programs, and in order to encourage community stability. So just a little bit of an update. I'm going to talk a little bit about progress towards goal as impacted by COVID-19. Based on review of the 3rd quarter program reports, a number of the agencies with which the city contracts continue to experience impacts on service delivery due to COVID-19 and the resulting public health directives. Programs that provide medical services and street-based services have been particularly impacted. This includes APLA's Homeless Support Services for people living with HIV and AIDS, Friends Research Institute's HIV education, the center's mental health, sexual health, and TEEP programs, Tarzana Treatment Center's outreach program, and Planned Parenthood and Saban Community Clinic. In addition, programs that include service categories based on educational activities provided in a group setting such as Seeds of Hope continue to be impacted. The agencies have worked to modify service delivery methods so that services could be provided while still keeping community members and staff safe. So at this point, I'm going to turn it over to Derek so he can give an update on Transcend Work's probationary status.
Good evening, commissioners. In May of this year, Transcend Work was placed on probationary status due to lack of satisfactory progress towards goal. One of the conditions of probation was that program staff attend each Human Services Commission to give a report to the commissioners on their efforts to provide service to more community members and also to employers. As you're aware, probation is a preventative measure and it's not punitive. City staff met often, sometimes weekly, with Transcend Work staff to plan and strategize ways to increase service delivery. And we're happy to report that at the end of Q3, Transcend Work demonstrated significant progress towards a goal, especially in the service categories that were identified as underperforming back in May. So as noted in the staff report, Transcend Work has successfully completed their probationary period, and they've been included in the roster of agencies and programs recommended for contract renewal. And I'm happy to answer any questions about Transcend Work after the staff report. Back to you, David.
Thank you. So I want to talk a little bit about unspent funds and contract savings. I'm doing a little bit of a deeper dive because, as you'll see, we'll go to the attachment to the funding chart. That's what we're asking the commission to approve. So you're going to see what the approved budget and then the supplemental funding that we're asking to continue and how we're looking at covering those additional costs. So unspent funds and contract savings. 3 of the contracted agencies brought into service at the onset of the 2019 through 22 contract cycle, Awakenings Recovery, their outreach, JQ International, and St. Thomas the Apostle, were unable to make satisfactory progress toward the agreed upon goals. As a result, there was a mutual decision to terminate these contracts. The city will continue to have a fee-for-service contract with Awakening Recovery to cover the cost of community members accessing their residential treatment services. In addition, NCJW's regular rental assistance program saw very little access this contract year due to the majority of applicants meeting the qualifications for COVID-19 emergency rental assistance. So in response, the NCJW general funds contract was reduced by $25,000. 2 pilot programs addressing initiatives highlighted in the 2019 RFP process, the HIV Zero Initiative and Aging in Place, came to a conclusion the second year of the contract cycle, the year we're completing right now. They include JFS Comp Services Center's Life at Home program and Step Up on Seconds PEP Prep program. So staff is recommending these contracts be amended to reflect the reduced scope of services and budgets. Finally, Betzetic Legal Services did not facilitate immigration clinics this contract year. So as a result, payments were reduced and the recommended 2021-22 scope of services and budget reflected decrease in service and funding respectively. So unspent funds from the 2021, 2020 and 21 base budgets for these contracts will be applied to the supplemental program funding allocations, which I described previously. So attachment A, and if you could pull that up, D, attachment A, the 2021-22 funding chart provides a complete listing of unspent funds to be rolled over to the 21-22 social services contract year to support the augmented programming. So can folks see the funding chart? Because I'm going to have to put on my glasses. Everyone else able to see? Yes?
Yes, David, I can.
Okay.
Thanks.
All right. So, and I know this is a lot of info, but we do want to, you know, for one thing, be transparent and just tell you, just kind of walk you through it. So here's the funding chart. So here's all your agencies that we fund, the agencies and the programs. This first column, this is the approved budget, council approved, going into this new fiscal 22 year. So as I mentioned before, the approved budget for social services is $5,179,267. So I mentioned that since the onset of the cycle, we requested, with the commission's approval, some augmented funding. And that's what you see in this column, augmented funds. So the Alliance for Housing and Healing, we started the Aging in Place Rental Assistance Program this time around, this pre-COVID. So they received additional funding for that. Ascensia, we increased their outreach team, the staffing on their outreach team, and gave additional funding for that. Went down here to the center, senior services, we gave additional funding for that. This is a lot of those funds went towards placing our seniors in their new Anita Mae Rosenstein development, which is still happening. Those placements are happening, and to provide wraparound services once folks get in there. National NCJW, we expanded the rental assistance program. So we want to put that money right back in, even though we did save $25,000 this year. And then Seeds of Hope was completely funded through the supplemental funds. And as you know, as you recall, this is the fresh produce delivery program that serves all of the housing core buildings. And now we do a grab and go program for other community members, other seniors and folks with disabilities at Plummer Park. So that's their supplemental funding. We gave additional funding to Step on Second to increase their street outreach team and the services they provide, and then Translatina for additional case management. So this is all the supplemental funding. It's actually been reduced, as I mentioned, from the first year, but it comes to an additional 318,481. And so now what we're asking for is a total. It's this approved budget plus the supplemental gets to this. This is what we're asking for this year, 5,497,748. And basically, what the direction is, okay, then find the money to pay for it. So, because right now this is all that's approved. So we're beginning to tell you where the money's coming from. As I mentioned, some of the contracts, like here's 2240 from Bethesda. They didn't do immigration clinics. This is some of the expense from that. So this is not going to be paid out this year. TEEP at one point was unable to provide street-based services. So we had some salary savings here. NCJW, I mentioned, they didn't need all of their regular rental assistance money. Here's 25,000. So it goes down. This is money that will not be paid out this current contract year, which ends at the end of September. So already we've got 40,828 to go towards the supplemental. Now, in addition, it's such a new day, as the commissioners who've been here for a while. With Drug Medi-Cal, we have barely had to access the treatment pool of funds. This used to be just a few contract cycles back, as commissioners recall, we used to spend up to a couple $100,000 on treatment. And now there's Drug Medi-Cal. And all of our community members who need services qualify for Drug Medi-Cal, except for folks who are undocumented, who we will serve, and that's why we still have a treatment pool of funds. Well, Awakenings had 6,625 left over. Tarzana had 14,826. So we're asking to roll that over, 21,451, and then we're going to add 3549 to make it an even 25,000. So we'll have 25,000 this last contract year for the folks who are fee for service, who need to cover treatment for community members who don't qualify for Drug Medi-Cal. So what and I will take questions. I know it's a lot, especially for new folks, but what we're asking is for the commission to approve these recommendations. Basically, you are approving this column, which is our regular programs plus the money for supplemental programs. And we will take this recommendation to council, and then we'll come back once this contract year ends, and we get go through all the Q4 quarter 4 cost reports. There will be some additional money returned. There usually is. We'll come back. We'll see what the total is, and we'll see how much of this 318, 481 we can cover. Hopefully, most of it. And then if not, see if you recommend that we go to council to ask for additional funding. So that, I know that's a lot of info, and I'm open to any questions. All of the program administrators are here. If you've got questions about specific programs, you'll see in that staff report, the last 2 pages, I believe, list all the agencies that we fund and a description of all the programs and services that are funded. So with that, I will turn it over to Chair Davis if you have any questions.
Are you going to leave the, oh, okay,
Oh,
thank
okay.
you. That was my concern. All right. I will take questions. I see Commissioner Darvish's hand first, so go ahead, Commissioner Darvish.
I had a question. I wasn't clear about the effect of COVID and the needs for raising that budget. What part of this $300-some thousand is COVID related? And then the second question is, any of the state or federal funds that are dedicated to the CARES Act, does this kind of take some of that into consideration, or is this separate?
So I'll address your first question. So the supplemental funding, which came to that 318,000, and you saw that now 7 of the programs were recommending the supplemental funds. That was pre-COVID. So we came, the commissioners will recall, we took recommendations during that RFP process for funding, and council asked for us to address in that funding process the intensification of social services needs. And they were looking at, Commissioner Darvis, the increase in the need for homeless services. They were looking for an increase mental health, substance abuse treatment. And then we had just been introduced to the Poverty Initiative and Aging in Place. So we looked at the proposals that we received during that process and where we could supplement to address that intensification of needs. So that's what that 318 is for, and each of those agencies we're addressing either poverty, homelessness, mental health services, HIV. So that was the first part. Then the second part about the CARES Act funding, and we have applied, so that is separate. These are general funds. This is the city's general funds that are funding these contracts before you. And the general funds cover social services contracts, and that's what this commission makes recommendations on. We do, and I will provide at the end of the meeting an update on the emergency services provided through emergency funding, which we are we report everything to finance. They're working with FEMA. We are trying to, continue to get those funds reimbursed. So that includes, the emergency rental assistance through NCJW and the Alliance, the emergency home delivered meals through Project Angel Food, legal services through Beth Sedek. So a separate funding pot. And we did receive some CARES Act dollars, and the CARES Act dollars that we received were emergency due to COVID, and that went to the rental assistance programs with NCJW. Any other questions from commissioners? Commissioner Meltzer.
Yeah, it's not about funding necessarily, but these 2 things came up in the report, and I'm just curious. Modifying service provision, going back to the way it was pre-COVID. For example, participants in Project Angel Food's emergency home delivered meal program are being encouraged to apply for its standard program. Those who don't qualify for that, eligible participants or living with a chronic disease, have the option of accessing JFS's home delivered meal program, available to homebound community members 55, regardless of health conditions. But some of the people who are getting meals from Project Angel Food, they're not 55, or are they all 55? And what happens to those who are not 55 or over?
Joan, do you want to jump in?
As soon as I can unmute myself. Project Angel Foods program was, the emergency meals were just 55 and over. The others, some have worked in different ways with their case manager, usually at the Comp Services Center. So some of them have gone on to the JFS program. Some of them got food through Seeds of Hope and produce through Seeds of Hope, and then assistance with other food programs. But the overwhelming majority of people who have sought out assistance have in fact been over 55.
And I'll also just add for the JFS nutrition program, to be eligible for that program, it's 55 and older, or a disability at any age, or low income at any age. So that should also, if there are folks,
Thank you.
yeah, so if there are folks from Project Angel Food who
Okay.
fit in those categories, that should work too.
Okay. And another strange question. I mean, it just popped up. The money that is given to those people who live in HUD buildings for their annual or semi-annual cleaning services, and I didn't know about that. Who cleans or helps when there's no money coming in?
So that money is tied in, and you're correct. We were asking for that to be rolled over as well, because once COVID hit, the annual inspections of those HUD buildings, just like a Section 8 unit has an annual inspection, make sure that, your smoke alarm's working, your, various features are working, and that the unit is in, good living condition. So with those funds are dedicated to any of our community members in those units who need assistance, basically bringing it up to code to make sure they pass those inspections. Those inspections stopped during COVID. So I think there was a total of $12,000 at the beginning. We had a few inspections. We had some folks that needed assistance. We get the assistance coordinated through JFS, through the Comp Services Center. And we've been told that they will begin to resume again this contract year. So we have funds available if folks need assistance bringing their units up to the level of the inspection.
Okay, thanks, David.
Any other questions from the commissioners? Comments? Excuse me. Commissioner Shandrick?
I just wanted to ask to make sure I am sure about the treatment pool of funds. So and for the other commissioners, the substance abuse providers that are contracted with, they're paid more on a by case basis for people utilizing services. So there's a pool. So we're David, you had said that would be for the next service year 25,000, and it seemed like there was a $20,000+ savings. So is that correct?
That's correct. So we actually, this current year that we're finishing, there was also $25,000 available. You are correct there. We have the contracts with Awakening Recovery and with Tarzana Treatment Center, they are fee for service. So when we get folks into beds, there's bed night rates depending on the level of service. As I mentioned, the overwhelming majority of community members who need those services qualify for drug Medi-Cal, so that the facilities don't need the funds. But we have had folks who are undocumented or need to get into treatment right away, and the drug Medi-Cal hasn't kicked in yet, so we'll cover the nights until that does. So we had a little over 21,000 left from the 25 this contract year. We're asking that to be rolled over. We're going to add 30, I'm sorry, it's not in front of me, but like 3,200 to make it an even 25,000. Okay. Joan can tell you right now, actually here, I keep putting people on the spot, but we actually do have folks in treatment as we speak. Correct, Joan?
We do. We have right now. We have someone at Tarzana, and we have 6 people at McIntyre House, which does not get paid on the bed night. They have a social services allocation at like our other programs.
And then I'm fine with the proposed the supplemental increases staff has proposed, and just we're still in the pandemic, so there still may be some restrictions of services. Beth said it may be focusing on eviction issues rather than immigration services. So even though that money is committed, it could come back at the end of the service year in 2022. So I just want to say that. And then two quick things. I think it was the last meeting, Alliance for Housing and Healing was being merging with APLA. Is that happening soon, or are they being, are we kind of naming them separate entities at this point, or just curious in this renewal cycle?
Derek?
I can answer that. Yes, they have merged as of July 1st. So the Alliance for Housing and Healing is part of APLA, but they maintain their kind of separateness with staff. Terry Goddard is still the executive director. They still have a finance director. So although they've merged, they're still kind of separate entities or separate programs, rather. Okay.
And then the last thing, I know in our PrEP discussion last meeting, we said the LA LGBT Center sexual health program didn't cover PEP. So just in the recommendations, it says that they're covering both PrEP and PEP for the dollar amount the city's funding.
So yeah, I'm going to ask Derek for clarification from that, because I thought we did have both PrEP and PEP through.
It's part of the sexual health services, but it's not specifically called out in the scope of services. So we fund HIV testing and treatment services. That kind of linkage to PrEP and PEP is kind of part of that service, but paying specifically for the medication, no, that's not part of the contract.
But I think that's a really good point to bring up, because with all of our contracts, we're leveraging the city's funds. For many of our contracts, we're a small portion of their overall budget. But so we do target, as you just pointed out, Commissioner Shandrick, for certain services, say for sexual health, HIV testing and treatment. But our community members have access to their full, menu of services. So if a West Hollywood community member went to the center and they needed PEP, they would have access to it. It's just not, our dollars aren't going specifically there.
Thank you.
Is that good, Patrick? You're good? Any other questions from any other commissioners? Commissioner Meltzer?
Just a comment. I just got a text that Jimmy lost his internet and he's fighting his way back. Oh, wait, he's back.
Oh, there he is.
Okay, never mind.
Well, all right. Jimmy, do you have any? Oh, I'm sorry. Commissioner Freiberg?
Hello. I don't know if this is something to bring up now. When I was on the Disability Advisory Board, we had a presentation by JFS about their quality of, or their home delivery service. And I had asked the woman what they go by, because I looked at the menu and I was, to be honest with you, I was kind of shocked what was on that menu, considering that you're feeding people food that may cause cancer or have been known to cause cancer. And I asked her, how do they figure out their, nutritional values? And she had mentioned that they use the USDA pyramid, which is really concerning because it's very politically motivated. I mean, even the Harvard School of Public Health has talked about this a lot, and they came up with their own plate, healthy eating plate instead of the pyramid. But I was so concerned about it, not just for people's health, but for greenhouse gas emissions, all of that, the environment, air, water, that I actually spoke in front of this commission, as a citizen about this issue. And then I noticed that it seems like everything is still the same. I saw one of their menus, and it seems like everything is kind of still the same. And I'm a little concerned about the food that they're serving. So I wanted to make sure that we're actually, getting quality of service, not just giving them blank, like a blank check just to get whatever food they want. I want to make sure that our residents have the best food possible for them, especially, if they have health conditions. So I don't know if that's something that I should bring up now, or this is something I could talk about maybe down the road.
Well, absolutely. You may want to bring it up under commissioner comments. If you would like, Commissioner Freiberg, we can come back with a report on their, on JFS nutrition. I know that you reached out to Katie to find out a little bit more about their, how they do their meal planning. So we would be happy to bring, a report specifically to JFS nutrition, and we include our other meal services, the Project Angel Food and Seeds of Hope. So if you'd like to bring it up under commissioner comments, and if the commission would like us to bring a report back, we would be happy to do that.
Okay, yeah, and also because they actually did update the pyramid for 2020. It's still, Harvard still has a problem with it because, like I said, a lot of it is politically motivated through the meat industry, the dairy industry, all the different industries are getting their name in there. So I would definitely appreciate if we could just revisit that or get a report on it.
Sounds good. I will let you bring it up under commissioner comments.
Thank you.
Thank you.
Maybe also just briefly, Katie could talk a little bit about Seeds of Hope and why there was funding put to that program as kind of a counterbalance to some of our other food programs.
And actually, Joan monitors the Seeds of Hope program.
So Seeds of Hope has been in 8 different West Hollywood Community Housing Corporation buildings, and the sort of heart of their program has been the produce distribution. And then during COVID, they partnered with our transit providers, American GTS, and they were able to deliver fresh produce to every single household in those 8 buildings. The other pieces of their program, which have had to be modified because of COVID, include nutrition education and cooking classes. So what they do is they go into the buildings, and this is pre-COVID, they go into the buildings, they have a cooking class, they help people learn about the nutrition, and then they distribute the produce. They also help people in the community gardens there, so that their whole focus is on the healthy produce and healthy eating. During COVID, they had to modify a little bit, and what they did is to produce nutrition education and cooking videos, but their entire focus is on produce and healthy food.
Thank you. Vice Chair Palmieri, did you have a question?
I'm sorry, my internet went out and I had to reboot 3 times, but that being said, I'd like you to start the meeting over.
I like that. Okay. Are there any other questions that I might be able to help you with? And seeing none, I do have a couple of questions. Ow, gosh darn it. The $318,000 and 481, the large number there on the bottom that says augmented funds to be paid by using contract funds. I looked through the contract funds that you gave us in the report, and I added them, and you don't get really very close. I'm sorry to say. So I'm concerned about that, A. And then B, when you have the National Council of Jewish Women, you have $25,000 savings on one, in a rollover. Is that rollover part of the $35,000 that's being augmented? So actually they're only receiving another $10,000 plus, or is that 25 on top of the 35?
So the 25, okay, well, so the 35 is their supplemental funding. And that is what they have received the previous 2 years as well. That expanded their regular rental assistance program. So in this current year that we're just wrapping up, they didn't need all of the funding for regular rental assistance because almost everybody that they worked with qualified for COVID-19 emergency assistance. So they didn't spend $25,000, we took it back. So they are getting the original contract amount with the augmented funding, and we've got $25,000 to, cover some of this supplemental. So that 25 basically was not paid out to NCJW. Their contract will be fully restored this year, plus we'll have $25,000 to cover the supplemental.
So it would reduce the $35,000.
Yes, yeah,
Okay,
correct,
because
correct.
you're confusing me. You've got numbers here, and I want to know where they belong. Excuse me. So my question is, some of the programs that you also mentioned that were going to give us back unspent funds or unused funds are not in my report. And so there's an issue where it's very hard for me to get A and B to equal C if I don't have all the numbers to go with it. So I'm not sure I like this, even though I don't disagree with it. I just don't really care for it because I like to know where my money's coming from and where it's going out to. And so I try to make a balance. And you're shy about half of it, in my opinion. And so I'm not certain where you're thinking. Did you say that was going to come from council? You were going to go and ask them for additional funds, or you believe that will all get covered in unspent funds?
So, and this is similar to what we did last year. So you're correct. This is just A, we don't have B yet to get to C, but what we brought to you tonight is what has been identified, well, what's been identified so far in unspent funds and or rolled over funds. So we're right, we're in the last month of this contract year. September is it. The fourth quarter is July, August, September. So we'll close out the contract year. We'll get our fourth quarter cost reports. The program administrators review all of those, and frequently we have money returned. If it's, either, it was unspent or sometimes misspent. So we will see, and frankly, that's where we see the majority of the return funds at the end of the year. We really, well, we always closely monitor, but even more so this year. And we were more kind of proactive. And when we saw a program like NCJW's that, wasn't accessing the funds, we took it back. I mean, we had conversations. Everybody knew what the strategy was, but we took it back right away. So we knew, because we knew we would want to begin being able to cover those supplemental programs in the last year. So what you see here, Commissioner Davis, is just the initial identified, unspent funds and rolled over funds. Once we finalize Q4, we review those cost reports, then we'll get the bulk of the returned funds from the agencies. We'll come back to the commission, and with that report, that'll probably be in December. And at that time, we'll see how much of that 318,481, and you're right now, we don't even have half covered. We'll see how much we can cover. And then we will pass a recommendation by the commission to ask for additional funding through council.
So what this report will go to council, and we're saying we want the $5,497,000 plus money, even though we don't have quite all of it yet. This is how it's going to work, and this is how we intend to try to pay for it. And so we're going to kind of ask them to do exactly what you've asked us to do, which is sort of like believe that it's going to show up.
So with this recommendation, if you approve it, basically you are agreeing with the base budgets, that $5,179,267, and that's all approved. And then you are, yes, you're approving our supplemental programming with the follow-up that we'll come back to you with the returned and unspent funds to cover that additional $318,481. If we're unable to cover it, then we'll look at asking for additional funding. We did this again last year, or not again last year. We did it last year as well, and actually we We asked for more funding. We didn't have, we asked for about 340 of the original supplemental. So we're doing better towards covering the supplemental funding. You know, and I know I don't have to tell you this, Chair Davis. I mean, we don't want the money back. We want, you know, we fund at, you know, the appropriate level, and we want all the funds to be expended. So it's a little odd, I admit, and believe me, you know, as a manager, and I have these conversations with staff all the time, because we're also, you know, we're really good stewards of the money, I believe. And, you know, we are watching how things are spent out. We know where the need is. And if a program, you know, is having challenges or things played out so differently during COVID that it's like, okay, so they didn't need that full funding. We're not going to pay it completely out. We're going to use that to cover the supplemental programs. Those are all that supplemental programming, as you can see just from the conversation, those are still really needed. Those are, you know, those are HIV and AIDS services. Those are street-based homeless services. Those are food and nutrition services. Those are, you know, and those are addressing that intensification of social services needs that was identified in 2019.
Okay, so when you have the budget from 21, 22, and then 21, 22, oh, now I understand. Because I didn't see, I don't see any like COLA increase in the amount of monies from like say the 128 for, let's just say the Alliance for Housing and Healing is $128,253. Does that represent money that we've given them plus the COLA already in, or is the COLA, so the COLA is already there?
Right. So if you look down at the bottom, what's budgeted is that $5,179,267. That's a 2% increase over what the social services budget was last year and the year before, which was $5,077,713. So we added 2% to that, and we got the $5,179,267. So each of those individual base budgets have been increased by 2%.
It may have been a little clearer if I'd have had the budget allocations for the two previous years, so I could look and say, okay, this is where it's going. This is how the numbers are marching. So I tried to figure out the COLA, and I tried to figure out where you were getting your extra monies. So I was wondering if it is just more, I don't know, prudent to just ask the council for the $300 and some odd thousand to begin with. And then at the end of the contract year, if there's money left over, we can return it to the general fund. And so if it's less than 300, we wouldn't have to ask them to augment it. We would just say, okay, this is how much we actually got back, so we're going to pay you back. Does that make sense?
Well, I understand your logic, you know, ask for it all up front now. Since we have, you know, a history of receiving returned and unspent funds, we're saying, okay, so this is a recommendation for fully funding. We'll come back and let you know how much of that we've been able to cover, and then we'll ask for the difference. So they would rather us, you know, just ask for what's needed. Basically, the expectation is we're going to cover it.
Okay.
You know, that we will cover it, and we shouldn't need to ask for any additional funding.
All right.
So we'll come back to you. We'll see how close we get, and if the commission is comfortable with our recommendation for additional allocation.
Okay, I think I'm happy with this. Now I think I get an idea of it, and trying to compare apples and oranges is also the problem. I shouldn't use A, B, and C when I actually like fruit better. So it's apples and oranges, or I needed the other year, I think.
Yeah, and that would help. Yeah.
That would probably have helped me out. I know right away that your 2% was already in there. Okay.
Duly noted. Yeah, we will in the future. We'll show you the current year's budget and then the 2%.
Yeah.
And
in the future years. But all right.
Yeah. Thank you.
Thank you, sir. Anyone else have anything I need a motion on this. Is this correct? Can I have a commissioner move and a commissioner second the budget as proposed?
I'll move to adopt the budget as proposed.
Okay.
Or
Okay. Moved by Commissioner Byers and seconded by Commissioner Darvish. I believe to beat you out a little bit there, Commissioner Meltzer. So, D, may I have a roll call? Unless there's any other discussion. Hearing none, may I have a roll call?
Commissioner Byers, am I off mute?
You are now.
Oh, sorry. Commissioner Byers,
aye.
Commissioner Darvish,
Aye.
Commissioner Freiberg,
Aye.
Commissioner Meltzer,
Yes.
Commissioner Shandrick,
Yes.
Vice Chair Palmieri,
Yes.
and Chair Davis.
Hi.
Thank
All
you.
right. Thank you all very much.
Thank you.
Thank you for the reports. And we will move along. Except for I've misplaced myself. So we will move to new business, and that would be the review of the updated code of conduct for elected and appointed officials. And I believe we have the city clerk, although now I don't see her.
I'm here.
That's you. Okay. Sorry. Pardon me.
And if
There
my
you
logo is backwards, let me know. It was interesting. Typically when I come into Zoom, is it backwards, Commissioner Byers?
If yours is, mine is, that's how that's gonna go.
Okay, I'm not going to worry about it for right now. So good evening, Chair, Vice Chair, and Commissioners. I was asked by staff to come and share with you the updates to the Code of Conduct. The council back in March decided to make some amendments to the Code of Conduct. Some of it was simply cleanup language to make sure our pronouns were correct throughout the document. And some went much deeper. And as all of you are familiar with, the Ralph M. Brown Act guides how we handle public meetings. And Rosenberg's Rules of Order are a parliamentary procedure. And then all of us are also governed as city employees and appointed officials on a commission to the Political Reform Act. And those are what we would consider just the baseline. So at a minimum, those are the things that we have to do as elected officials, appointed officials, and specific city staff. So the Code of Conduct now takes it even a step further, specifically around the recusal rules. David and I spoke yesterday so that I could really touch upon things that affect this commission. And one of the things we talked about was in the past, during the social service contract renewal process, where you have public hearings, all related to which social service providers we move forward with, you'd have been advised to recuse yourself if you partook of any of the services from any of those contract service providers or had a specific conflict under the Political Reform Act. I'm actually going to recommend, and David and I talked about this yesterday, so he knows that if those conditions that I just shared, that you partake of those, any of those service providers, you don't have to recuse yourself. If you feel, based upon your experience in dealing with any of those providers, that you're unable to vote unbiasedly, then you should abstain from the vote. Because for several reasons, recusals have very specific guidance, and typically we would ask a commissioner to reach out to either the city attorney or myself and walk you through the steps to see if it reaches the level of a recusal. For most of you, it's not going to reach that level. The abstention works better because you can simply say, I cannot vote unbiasedly on this item, so I'm going to abstain from the vote. And the reason I'm kind of giving that language is, again, if you are partaking of any of these providers, specifically around health related issues, I don't want you to have to give that information in a public meeting. So simply saying you have a bias and you don't feel you can vote neutrally or without that bias, we'll just leave it at that. You could even abstain simply if, let's say your neighbor, Mr. Smith, had a bad experience or has, you witnessed certain things happening with a provider. Again, you could say, because of the experience of my neighbor, Mr. Smith, I don't feel I can be unbiased around this. So that's how we'll apply abstentions versus recusal, because I'll get back to this new thing now with recusals. Not only do you have to recuse yourself from that one specific service provider, you have to recuse yourself now from the entire meeting. And so this new threshold really creates this, here's a scenario. You, as a human service commissioner, maybe let's say you are on the board of one of these nonprofit agencies. And so you would have to recuse yourself. And typically you would just say, I'm going to recuse myself from this one. And in the Zoom environment, you turn your video off and we would trust that you truly stepped away. If we were in person, you would leave the room. And now under these, and then come back and your fellow commissioners have their heads down because they voted a certain way, which may or may not have reflected how you think the item should have gone. And that puts all the other commissioners in a tenuous situation. So with these new recusal rules, it accomplishes two things. It forces you to recuse yourself and allows your fellow commissioners to vote how they feel is in the best interest of the community. And it also has the ability to kind of say, if you want to be an appointed official for the city of West Hollywood, we would prefer, that you not be on this nonprofit board if they have business before your commission, to really keep a separation between your professional life, or in this case, your activism on a nonprofit board, and what you are doing on this commission. And Lauren, the city attorney, and I really wanted, after this item was passed, to pull different commissioners from different commissions so we could have quite a few of you in one meeting and go through kind of how all of this is going to apply to you and affect you. And I apologize that that didn't happen. So I'm grateful that David asked me to come before you so we could touch upon some of this stuff. So that was the biggest one David and I wanted to talk about, specifically around the upcoming social service contract renewals. The other thing we kind of wanted to touch upon is, again, either because you're a community member who lives in West Hollywood and partake in some of these services, or you have a neighbor or someone that does it, we felt it was a good time to kind of talk about, as a commissioner, you represent, the entire Human Services Commission, and by that, the community of West Hollywood. And that's really the work that you're appointed to do, is represent those individuals who come to live, work, and play, or in this instance, who partake in the many wonderful services that our city, through this commission and finally our city council, does. And I think that's one of the great things that we do as a city, is all of our wonderful social service programs. And so, again, if you have specific challenges with a provider, it's really best to work through David or work through Leslie to address any of those things, to ensure that we as staff who are overseeing this contract and the scope of services associated with it, that provider is meeting our needs. And it's part of like the report card that we do for all of these providers too. And also, to always, keep in mind that collectively you work as a commission and you represent the community. And so we should always think of it in that way. But if you did feel strongly and wanted to really comment on any of these providers, you're always allowed to do that under public comment for the item at the city council meeting. And you would just do it in your capacity as a resident or someone who is receiving those services. What are a couple of other things? Again, it's for staff that, oversee these contracts and ensuring that all of our providers are doing what we have asked them to do. Again, if staff isn't involved in any challenges that these providers are having, it's hard for them to address them. So again, it's, we're encouraging you to work through staff. So, for most of you on this commission, the code of conduct really changed just in the recusal process, because for some of you, if you do sit on a nonprofit board, there may be some times that you and I have to talk about whether you need to recuse yourself. But mostly it's always just an affirmation of you needing to work as a commission. You're one of 7, and all of the work that we do as city staff, commissions, advisory boards, and our elected officials is for everyone who partakes in not only our social services, but who come to live, work, and play in West Hollywood. I think I have touched upon most of the things that David and I talked about yesterday, but if I didn't, David, let me know and I'll chime in on those. And then I'm here to answer questions, concerns, comments.
I think it may, whoop,
I'm sorry, go ahead, David.
sorry. I think and you might have covered it, Melissa, but I think as we enter the funding process, the commissioners, they receive all of the proposals. There's usually close to 50. They review them. I think just as far as, there's, especially with new commissioners, there's sometimes the urge, touch base with somebody who's done this before.
Yeah.
To, sometimes with the more experienced, they kind of mentor the new commissioners and just what to be careful with.
Yeah, and Lauren and I have talked about this a lot because, we do have a lot of new appointed officials and we do have a lot of seasoned commissioners, advisory board members who, I can tell you all about the Brown Act and Rosenberg's Rules of Order and, talk at you for 2 hours about a certain topic. And, she can have a conversation about something, but, Lauren really does feel there's value in having a fellow commissioner that you're comfortable with to bounce things off of. The only, and I trust all of you in this, is that make that agreement between the two of you that whatever you're talking about and stay away from talking about how you're going to vote on something, but really make a pact between the two of you that you're going to act as, each other's sounding board or, commissioner buddy or however we want to call it. And that you will not talk to another commissioner about the same topic so that we don't get into a potential serial meeting and a Brown Act violation. And, it's, we oftentimes want, I will say that I'll step back. I don't think anyone appointed, elected, sets out to violate the Brown Act. I think most of you, all of us have good intentions, and then sometimes it just happens. And we thankfully as a city do really well. We don't get complaints around Brown Act violations. So thank you for that. And, I think, as I said, that there is value in a newly appointed official having a commissioner who they can bounce ideas off, or even, can you help me understand XYZ? Or how did we get here? And even, having a cup of coffee, bouncing ideas, or, going somewhere and talking about something. If you can not talk about how you're going to vote on something, not get too much in the weeds of things that are under your purview, but if you do need to bounce something off, that's fine. And just really every once in a while do a check, am I keeping it to just my one other commissioner that I'm talking to? Am I not talking about how I'm going to vote on something? Am I just making sure I'm asking like clarifying questions or just trying to get a little more background on this item? And, I think if you just do that, then we're okay. And then, if you ever have questions about whether it's okay to do something or not, I'm always here if you want to ask. And, I think I have conducted an orientation for probably 3/4 of you, are more seasoned commissioners. You've been appointed long before we started our orientation process, but we did get the handbook. We used to do our annual trainings, and I hope to get those going again in the next couple of months. So you're going to have lots of fun with me in the next few months. What I call fun, and you probably will call torture at some point. And people's perceptions become their realities. And, you could be having a cup of coffee at Joey with a fellow commissioner and really not even talking about anything related to the commission. You could be talking about how you walked your dog Obi to the park over the weekend and how nice it was. But somebody in our big, small 1.9 square mile city sees you, and all of a sudden, my office gets a call that, I saw 2 commissioners and they were talking about, Human Services Commission business. And I call and talk to you and you're like, we were having a cup of coffee. I was telling him how it was so nice at the park with Obi, something like that. So always try to just keep that in the back of your mind, because, it may not be the case, but people perceive it that way. And so we just have to be really careful around all of that. But again, I trust all of you to do that. I've never had any challenges with any of you as long as I've been in the city clerk's office. So thank you for that. And our newly appointed, you are really good about asking questions when you're not sure about something. So thank you for that. And I think Chair Davis is part of the reason I'm here this evening, because he felt it would be helpful to the commission to have a little refresher, and David and I agreed. And again, I apologize that Lauren and I didn't get to do our little round robin with everybody, but it is still on our list. And so those of you that want to do a deeper dive into the recusal things, which again, I don't think any of you would meet that threshold, but if you would like to talk about that, we can. So David, if there's anything else you wanted me to address, otherwise I'll open it up to comments or questions.
I think you covered what we spoke about. Thank you.
Great, thank you. Okay, hello, Commissioner Darvish, how are you?
I'm fine, Melissa, Madam City Clerk. You're so wonderful and so present and available. I myself, as a new commissioner, I don't think I would have any issues. A lot of it's common sense to me, just being in management and healthcare management. None of it is troublesome, just guidelines that we all follow, although some of it is specific to the city and just sort of the business that the city conducts. But I just wanted to express my appreciation to you and the orientation that I got. I know there are 3 of us here that are new to this commission, but the support that we also get from the fellow commissioners, from Chair Davis to Vice Chair Palmieri, to the rest, to Barbara and, Commissioner Metzer, and Sean DeGette, all of you. I mean, that they call us and we stay connected, so we feel the support, but we appreciate this reminder. This is great to sort of hear again, and the more every time you hear it, you pick up something new. So thank you so much.
You're welcome. Thank you for having me this evening.
Anyone else? I actually have a couple of questions.
Sure.
On the Mr. Smith tells me something that I didn't really want to know, maybe, and says that he's having trouble with a particular organization. Normally, I would also bring this up with David, but I would also bring it up with the organization during some type of a meeting. I would want to know maybe what kind of grievance procedure they have. I mean, I wouldn't be specific in saying Mr. Smith has a grievance with you, but I would like to know what their grievance procedures are and how they can be utilized. Or I might work off of information that I have, especially from the community, that isn't necessarily detrimental to anyone. It's just trying to maybe fine tune the organization to make it work better for people. I mean, people walk up to me in what's their names, the grocery or wherever I happen to be, pavilions, and they'll say something, they'll talk to me about something they know. I've been sort of here for a long time, so I get information that I don't always pay attention to. But then there's some information I would pass to staff if there was, I thought, an issue like some kind of abuse or some kind of an actual problem. But I'm going to use that also in my normal commissioner way of doing things. So I'm not certain why I can't use it.
So I think, because, and correct me if I'm wrong, David, but when you do the actual review of all of the providers, isn't that a public hearing?
We do have a public hearing, yes. There's a number of public meetings throughout the process.
Yeah, so, a public hearing is the judicial way of how we go through this process. And it is appropriate for you to ask what kind of grievance policy the organization has. You may want to say that you know someone who something happened to, and you just are trying to get a better understanding of how they handle grievances, and possibly after they give you their policy and you think Y could also be added to the list, you could say, as part of this process, is it possible to add Y to your grievance procedures? Well, we don't, because it's a public hearing too, and we want to keep the record clean. What we don't want to do is get, and even the Brown Act addresses this, is get into the back and forth with someone who is presenting, especially one of our providers, because one, it could muddy the record, and if there are any issues with the public hearing, that could be a challenge. And two, it sometimes has the opposite effect. Instead of making the provider step up and help us, or help, be willing to work with us, they become, it just puts them on the defensive, I think. And so I think it's appropriate to ask a clarifying question like that, and if possible, provide, an additional remedy. And then I would leave it at that. And then after the meeting, if I continue to have concerns, I think it's completely appropriate to email David and say, we had this public hearing. I wanted to keep the record clean. I did ask the one question I wanted to get across, but I still have some concerns. Can you help me address them, or can we ensure that these are addressed with the provider?
On the recusal, did you say that if I have to recuse myself from one item, I have to recuse myself from the entire meeting? Is that how I understand it?
Yep, that's the big change. Yeah.
So I personally have a conflict because I utilize a particular service. So I would have to recuse myself, or I would just have to say I prefer not to. But I mean, I don't have an opinion on their service one way or another. I mean, okay. I'm glad that they are there. I'm glad they give me the service, but I would still be able to vote on that service because the lawyer originally, when it went through, told me that I had to recuse myself.
No. So here's the question, the qualifying question. can you vote unbiasedly? So taking your experience with this provider out of the equation and vote yes or no with a clear conscience that you did it without any bias. If you can say yes, then you can vote on the item. If you feel, kind of on the fence about it, I would abstain from the vote and just say, I'm abstaining because I don't feel like I can be unbiased in my
From
vote.
that particular vote.
Correct. If it's, and I'm throwing this out there, so please, whoever's watching on YouTube, don't take this as anything. If you use JFS or Dial-A-Ride or one of those services, it would just be on the vote for that particular contract or funding allocation.
Then one other thing, like say there's an interesting, an issue going on in the city, and we want to have our opinion heard, and it's not necessarily something that's within our purview as a commission, like as a Human Services Commission, say it's in the Planning Commission, or it might be in rent stabilization or something else, and we want to write a letter. If we're allowed as a citizen to write a letter, but we don't sign it with our commission.
Correct. You would sign it as Stephen Davis, resident of the city of West Hollywood.
And that's how I would also, that's how I've always spoken to the council. Unless the commission, is the commission still allowed to appoint a speaker if necessary?
Yes.
Like we have had in the past.
You've done that in the past, I recall. Yeah. You've come and spoken on behalf of the Human Services Commission when the council was approving the, whether it was, David's, annual update, or it was the awarding of that 5-year contract, or is it 4-year, process.
But that would need to be voted on and agreed to by the commission itself. I can't just do that out of my own mind.
No.
Okay. Yes.
No. And we also have the liaison process where, if one of you wants to be a liaison to another commissioner board, you're able to do that. But that's covered in the code too. It says, when making public utterances, if you are representing your commission or board, you have to have been given the authority to do that. Otherwise, you are speaking on behalf of yourself. And, sometimes people say, I'm Stephen Davis, I'm Human Services Commissioner, but tonight I'm speaking as a resident of West Hollywood. And I'm like, I sit there and I go, so we can't unring the bell. People have already heard you're on the Human Services Commission, but I think people are just so used to doing it. But, occasionally they'll get an email from me saying, so remember what we talked about that you can, but.
Well, that makes sense.
Yeah.
I've heard it by someone going up and say, I have a commissioner hat, but now I'm not using my commissioner hat, I'm using my resident hat.
Right.
So you're already telling everyone who you are already.
Right.
Okay.
Right. And it's not the way we want to do it. The other way is, for those of you that are directly appointed, you could express your concerns to your council member, because ultimately this will come before them. And again, if you, as Stephen Davis resident, really feel strongly about one of the providers one way or the other, or the process, you have every right as a resident or even an interested party to come before the council and indicate that. Okay. So,
all right. Thank you very much for your time.
You're welcome. Anyone else?
Anyone else have anything, question or a comment? If not, we're going to release you.
Thank you. It's so nice seeing all of you. Have a nice evening.
Thank you. Now we're going to move on to the other new business item, which was the development of a citywide behavior health crisis response unit, which I have already suggested that they come up with a nice acronym, because that is just too much to say at one time. And I always want to make it behavioral. So, and I think I'm turning it over to Corey. So you may have the floor, Corey. Thank you.
Hi, good evening, Mr. Chair and commissioners. Thank you. Yes, we will have to come up with an abbreviated version of this as we move forward. So we're going to ask for your feedback on a lot of things, and maybe we'll come back for that as well. I'm Corey Plank. I'm the manager of the city's Strategic Initiatives Division, which, as you know, oversees the city's homeless initiative, our aging in place work, and poverty reduction efforts. I'm joined tonight by Elizabeth Anderson, program administrator in the division as well. I know you'll be happy to see her here as well. We're here to provide information to you and to get your feedback on the development of the citywide behavioral health crisis response unit. We look forward to talking to you about this, and then after the presentation, taking any questions you have and receiving your feedback as we move forward. And I want to thank Dee in advance for helping us with the presentation and the slides tonight. So if we can start to share the screen. And we've already said that's what we're doing, so we'll jump to the next one. There we go. So these are some of the questions to keep in mind as we share information with you tonight, and we will pop these questions back up later in the presentation. But as you can see, we want to get to your perspectives and your feedback on the need for this type of service, what you think will be valuable outcomes, your thoughts and ideas for how to make this type of service even more effective, and any other thoughts you have after you hear the information on the proposed unit. So next slide, please. As you know, and you're a key part of this, the city prides itself on prioritizing the well-being of the community and demonstrates this commitment by funding and contracting with social service agencies, investing in public safety, and by advancing civil rights and social justice issues through legislation and advocacy. The civil unrest of the last year and a half put government and other institutions on notice that continuing the status quo in our first responder systems can further perpetuate racial inequality and social injustice. In West Hollywood, we have been asking and exploring what could we do differently. So next slide, please. To answer that question, we started a deep dive into the strengths and the gaps in our existing systems. We know that our first responder system holds significant expertise in law enforcement with the Sheriff's Department and in life safety issues through the fire department. And as you all know, we have an incredibly robust portfolio of contracted social service agencies, as well as the block by block security ambassadors in PacWest, who also contribute to public safety and community quality of life. Next slide, please. So when we look at the system as a whole and begin to think more critically, it's clear there's an opportunity to enhance what the crisis response services are by broadening the expertise of those who are the first responders. We think one way that we can do that is through the introduction of a new responder option, which would be a behavioral health crisis unit. This type of unit would have the capacity to bring supportive services immediately to a person in crisis that has been triggered by a mental health condition, substance use disorder, or other experience, potentially trauma or other experience. Next slide, please. So here you'll see 4 of what we think are the most compelling rationales for introducing a behavioral health unit into the first responder system in West Hollywood, and how that unit would be a strategic enhancement to our local emergency system. So first, we think it will improve the quality of life for both housed and unhoused community members by connecting the person in need immediately to the appropriate level of supportive services to help stabilize them. That it will advance the city's racial justice and social equity values. For example, as we've shared here before, that people of color and LGBTQ people experience trauma and homelessness at higher rates. Establishing a first responder service that is specially trained and culturally competent, and one that can intervene with supportive behavioral health services, will help ensure that community members are matched mid-crisis to services that match their needs and help divert them away from the criminal justice system. Additionally, we think that this unit would help reduce the reliance on sheriffs and fire to meet social service needs, and that this would remove uniforms, guns, badges, sirens, which can all be overwhelming to a person in mental distress, from the system response when the presenting issue really is a behavioral health crisis, one that can be de-escalated effectively by this type of team. By reducing the demand on law enforcement and fire for social service and mental health related calls, those first responders will be able to even more effectively address crime and life safety issues in the city. And finally, the addition of this behavioral health unit would also further increase the connectivity between the city's emergency response system and the city-funded social services. As individual crises are stabilized, the behavioral health team can help people connect to our existing services and providers for further and ongoing support, and hopefully help them find an agency home that would provide the social services, mental health care, case management that they might need. Next slide, please. Stakeholder engagement, part of what we're doing tonight, and wanting to talk to you about what our kind of proposed team would look like, as well as to get input from you. That kind of community engagement has been and will continue to be crucial to the successful design of this type of program. To date, we have consulted multiple times in focused conversation with the West Hollywood Homeless Services and mental health providers, with CAHOOTS, which is the renowned program alternative crisis response model based in Eugene, Oregon, with the Sacramento-based Steinberg Institute about federal and state legislation that's connected to these types of services, and specifically regarding the capacity of the 988 system for potential dispatch operations. And you can see here in progress, we were at the Public Safety Commission last night. We're here with you tonight. We'll be at the Council Subcommittee on Homelessness later this month, and with the Social Justice Task Force next month. We've also sent a survey seeking feedback with similar questions out to all members of city advisory boards to get additional feedback and input. And with that, I'm going to be happily stop talking and turn it over to Elizabeth Anderson, who will talk to you about the proposed operations of this unit.
Great, thanks, Corey. Good evening, commissioners, and thanks, Dee, for landing to this slide. So next, we'll get into a summary of what the proposed behavioral health unit could look and feel like in West Hollywood. In the proposed model, the unit would function like a peer to fire and sheriffs in terms of the capacity to respond quickly to crises. And this would really expand the expertise of our first responder system. When a behavioral health crisis call comes in, the behavioral health unit would represent a third option that could be dispatched to respond to the scene independently or in collaboration with fire or sheriff. Next slide. So here we'll get into the nuts and bolts of the unit. And within the scope of services on the left side of the slide, the big ticket items would be the capacity to respond to mental health crises, to provide first aid and non-emergency medical care, to provide substance use disorder counseling, welfare checks, and transportation to additional services. The range of these supportive services are really important for all community members, both housed and unhoused. And the staffing mix would include multiple roles to cover this scope of services, including a crisis worker, a medic, a licensed clinician, and a case manager. Ideally, the team would be available 24/7, but it may be necessary to grow to that schedule through a phased approach based on call volume and also available funding. Next slide. So the unit itself would operate out of a wheelchair accessible van with room inside for health and mental health service delivery at the call location. The team would be connected to the emergency dispatch system and would need their own tech setup to run operations out of their mobile van. Now, in terms of community infrastructure that will be critical to the unit, currently, West Hollywood's contracted social service agencies provide community-based services on the street by appointment, and our homeless service providers will soon return to the library for drop-in hours. These invaluable nonprofit partners will continue to provide proactive service and be in a position to coordinate with the behavioral health unit to help community members with ongoing non-emergency supportive services after the crisis. And you can kind of think here about how our homeless service providers can plug in with the behavioral health unit, and also our mental health service providers can plug in through, for example, the LGBT Center or even JFS and the mental health services that they provide. Midterm, the city is looking at creating more accessible meeting space for people to connect with providers in West Hollywood, beyond Plummer Park and the drop-in hours at the library, and specifically related to creating places for people who are experiencing homelessness to meet with providers. In the future, as we follow goals of the West Hollywood Homeless Initiative 5-year plan, we are working on the feasibility study of a homeless service access center and a bridge housing facility, which will be a huge asset and resource for the behavioral health unit to connect people to on-site services. Next slide. So setting up community and city expectations of the behavioral health unit will help shape the success of the program. And here's some proposed expectations. The unit will be set up to respond to emergency calls. They will serve all community members, both housed and unhoused, visitors and residents. If the crisis calls for it, the behavioral health unit will have capacity to conduct assessments for psychiatric holds at the scene or loop in other resources if needed. They'll be able to connect the person in crisis to community-based social services funded by the city, and the unit will be able to respond to people experiencing homelessness, conduct welfare checks, and do other outreach on the streets of West Hollywood. But the unit will not be removing people from public spaces involuntarily, and they will also not be removing people's personal items. The city will continue to use its existing protocols for managing abandoned belongings. So setting community expectations will be an important part of building trust and establishing the value of this resource as a first responder service in West Hollywood. And we can continue to build out these expectations in the feedback that we're seeking from your commission and the other bodies within the city. So next slide. Now, starting a new first responder service is certainly not going to be as easy as flipping a switch. There will be local and regional challenges to making this program happen here. But we're not shy when it comes to overcoming hurdles. There are complexities to communicating with the county's 911 dispatch system and the developing 988 national and state hotline, which may have dispatch capacity in addition to the suicide prevention resources that will be offered through 988. There are limited housing and psychiatric resources here in the city and regionally, and there's also city and regional budget constraints that factor in. What's good is we know there is increasing national, state, and regional attention on establishing new ways to respond to people in crisis. And with that momentum will come a change in priorities and potentially funding that may help with the local lift of creating this crisis unit in West Hollywood. Next slide. There are planned phases to develop the behavioral health unit for West Hollywood, and we are currently in phase 1 at the direction of City Council, and we will be reporting back on our findings for kind of what's happening in phase 1 at the November 15th meeting. There is a lot of work to be done in creating this new program, and city staff across multiple divisions are involved, including social services, our colleagues in community and legislative affairs, and in public safety. Overall, the introduction of the behavioral health unit in West Hollywood really builds on the strengths of our existing system of social service agencies, as well as the services provided by the fire, sheriff's, and ambassador program. And it really answers the question of what can we do differently. This program can advance the city's racial equity and social justice priorities. It can broaden the expertise of our first responder system, and it can advance individual and community quality of life. Now with that, we will land on our last slide, and I know all of you have this in your packet as well. We are seeking your feedback to help shape the design of this program and to support the West Hollywood community. And we also just want to acknowledge as we get into this discussion tonight that this is one piece of a larger puzzle to address the behavioral health and well-being of the West Hollywood community. So this would, again, be the crisis response unit that would be able to bring mental health crisis services rapidly into the field and into people's homes. And this connects directly with many other large topics at hand that you work on here through the City Social Service Grant Program, and also with our work as we continue the homeless initiative and accomplishing the goals of the 5-year plan. As mentioned, the feasibility study kicking off to site a homeless service access center and interim housing here. So all of these things are connected not only with the things that we have local control and influence over, but it's also connected with broader regional systems and even state level systems that may touch or intersect with our goals of this specific program. So again, just focusing on this piece of the puzzle and really hoping for your feedback that can help shape the look and feel of it here in West Hollywood. And we look forward to the discussion. Thanks so much for your time.
Commissioners, would anyone like to go first? And Commissioner Darvish was automatically disqualified because he went first the last time. So one of you other commissioners need to go first. No, I'm going to let Commissioner Darvish go first. Then go ahead. Sir.
I'm passionate about this topic. Actually, I made public comment on this topic at the city council. I think it was 2 months ago. Also attended was on Zoom a session that had a discussion about the East LA family member that lost a son or a kid due to a response from LAPD. It wasn't in West Hollywood, the city of LA. And it was heartbreaking to hear the mother talk about the experience of having seen a kid getting killed in front of her by calling the line that she thought it would get a professional to come and help. So this is great to see from both of you, from Corey and Elizabeth. Great job presenting as a healthcare professional and someone that's in also in the behavioral health space around the country, trying to build access to underserved areas, which is a lot. You know, even in California, in big cities, we don't have access enough hospital beds or locked units to help these individuals that need the help support from professionals. And I commend you on this. Just to hear that the first responder would be a professional, a licensed professional. Not that our police force are doing anything wrong. They're just, again, I said this at City Council, they're trained to take control. And this population, once they see someone coming in uniform with armed, they just panic. And in that case, I believe that the kid was trying to reach out for the gun, thinking that he was going to be killed, and the officer then had to shoot him. So it was just disastrous. I'm not sure what the solution would have been in that case. I guess the police officer probably followed protocol, but anyhow, this is just such a complicated scenario that I think a licensed professional at minimum should be responding, assessing, evaluating the situation before dispatching the police. I know in some cases the police is needed to even protect the family. So again, someone qualified would make this decision. This is really great to see in our city. So thank you so much.
Great, thank you for those comments, Commissioner Darvish. And I really want to hold up what you focused on there with the idea of having a licensed clinician on the team. That's actually something that we that is represented in this recommendation based on feedback from the homeless service providers who have been heavily involved in kind of shaping the initial look and feel of the program, and also from our conversations with the consultant who represents the Cahoots team up in Oregon, which has been up and running for over 30 years there. And kind of learning from them, they don't have a licensed clinician on their team, but we could see the pros and cons of how their operation works. And in these conversations that we've had locally, we're able to lift up the recommendations of the homeless service providers to really put the licensed clinician as being a key role in the ability for the proposed unit to comprehensively respond to a person in crisis. So thanks for highlighting that piece.
Anyone else? Vice Chair Palmieri.
Thank you very much for your presentation and for the information. I did have a few questions, and full disclosure, of course, I spoke to Corey today, and one of my questions was about dispatch. That seemed to be a concern, and maybe you can just explain it a little bit further for my colleagues, like you did with me. It was because it cleared a lot up for me.
Sure, I can. Corey, do you want to repeat your comment?
No, go ahead.
All right, I'll jump in. Thanks, Vice Chair Palmieri. That's a great question, and also echoes the sentiments of your colleague on the Public Safety Commission, because dispatch really is the million-dollar question. How do we ensure that when someone calls in a crisis that they are connected to the right resource to meet their needs? And we know that this is complex. The 911 system in West Hollywood automatically connects the person to the West Hollywood Sheriff's Station. The need to have a highly trained dispatch person who can figure out if a situation is appropriate for the behavioral health unit or is appropriate for a law enforcement response, or potentially our co-responder with the MET team if there's mental health and potential risk of harm to the person or others. That will be absolutely critical. And we're also not only looking at, our West Hollywood station is one piece of a larger regional sheriff system. And in conversations that we are having with Department of Mental Health to better understand how they plan to implement the 988 number, both at the state and local level, we're beginning to learn more about how they are potentially framing the 988 dispatch that's run through Diddy Hirsch to serve the Los Angeles region could potentially have been trained up with the expertise to be kind of in radio and to be directly communicating with the 911 systems. Currently, City of Los Angeles is working with their police department and with Diddy Hirsch to pilot this kind of concept where a person might be calling 911, but they actually would be better served by a de-escalation conversation over the phone, or potentially being dispatched a mobile response to their location. So those are some of the things that we've learned so far. And even tomorrow, there is a Department of Mental Health Alternative Crisis Response meeting at 9 a.m. open to the public through their website, where they are talking further about this. They are, DMH is charged by the County Board of Supervisors of really trying to figure this out. And they're providing an update to the community that mirrors their quarterly updates to the Board of Supervisors. So they'll be discussing this more as well, but definitely dispatch and ensuring that there's no wrong door for a person who's calling and needs help.
I have a couple more, Stephen, if you don't mind.
That's fine.
So when I read this, this is something that I really support, that I really like. I realize it's in its beginning stages. As long as there's cultural diversity, as long as the whatever team or whatever group of people is going out understands the community of West Hollywood and doesn't compare it to every other one because it's not comparable. I think that this will be a very safe and a very humane way of helping folks, rather than getting them into the whole legal system and scaring them, or when I'm placing someone into recovery, the first thing is they think you're going to call the police, or you're going to call the sheriffs, or what did I broke the law. As long as they understand, and it takes sometimes 3 or 4 times of meeting with them, that I'm there to support them. There's no police involved. I think will be a huge extension of that, and I think it will be a welcome program. I'm hoping through Human Services, because I think this is something that's very, very worthwhile.
Are we good, Jimmy? Okay, Commissioner Melzer?
Thank you. It's really extraordinary. I looked up, I went on the Kahoot site and I learned about the Kahoot site, and I learned about the Steinberg Foundation, or whatever it is. And it's really daunting and overwhelming to think about it and to think of questions. But part of, I think the huge part too, is educating the community about these things. Everybody automatically goes to 911 when mental issues are what it's about, there's shame. People don't even make the calls. I mean, how do you teach people that help is out there, that it's okay to have these kinds of problems, and that this is the way you go for help? So there's education that will be required on every level. And they helped, I think in Eugene, now they have a larger population, much larger, but it was 22,000 calls they made in 1 year. I mean, it really is incredible. It just seems so daunting and getting a new phone number, even because we've tried that at the county, oh, don't call 411, don't call 911, call 624 if you need this kind of help. So I understand you have to start someplace. And I think it's extraordinary. And it will be actually wonderful and exciting to see this process as it grows up, as it really is exciting. So I said nothing that makes any sense, only
well, Commissioner Meltzer, I think you really keyed in on a huge component of this will be, how do you compete with 911 as a known number? Like 911 has been with us forever. So we're up against a pretty big challenge, not just our city. There are many other cities that are looking at how do you bring on this service, and then how do you help people know about the service. And I love that you're bringing your communications and PR and community education hat to this, because that is huge. And one thing that we are learning about as we heard from the homeless service providers that a WeHo specific number that could get you to a WeHo specific team is going to be critical. It's interesting as we're learning more that this is intersecting with the National Suicide Prevention Hotline number, which is like a 1-800 number. So, okay, good luck memorizing that would be 10 digits. Nationally, that's about to switch to 988. So, to your point, there's going to be multi-level communications push to make 988 a household number. And that seems like an opportunity that we really want to look at in terms of the benefits of potentially connecting this to a number that's going to have national, state, and local weight behind it, that potentially could have this niche carve out for a WeHo specific response. Because even though that number is national, when you're calling in this region, it connects with Diddy Hirsch. And then with what we're learning from DMH about the idea of having a dispatch capacity within Diddy Hirsch to send out crisis unit, this could be a really good intersection of larger community larger community education campaign that's going on around 988 that may be a good fit for the work we could do locally to promote 988. And the good thing about 988, unrelated to this, is that it is making mental health services accessible over the phone. And it kind of takes that component of shame and asking for help for people who might be more reticent to make that call and ask for help, when you can call 988 and talk to somebody over the phone. There's a different dynamic there that could potentially bring more people into services. And we know that the need for mental health services, especially over the last 18 months, is up. So appreciate kind of your zoning in on how important community education is going to be.
But it's also a neighbor who might be making the call, or a spouse who might be making the call, as opposed to a person who's making a call alone.
Yeah.
That's
true.
I want to ask about the Met team. How does this relate to that at all? If it does.
That's great. That's great. And so the Met team is also clinically capable of responding to mental health crises, but their team compromises the mental health clinician, the licensed clinician, with the sheriff's deputy. So wherever mental health goes, so too does the badge. And Met is able to deliver services in a more subdued kind of law enforcement presence. But they are really, really skilled at the combination of mental health crises and a situation that may have a risk of harm to the person or to others. So they have the capacity to kind of contain the physicality of a situation if that's warranted. Whereas the behavioral health unit is really using the de-escalation techniques that are verbal, that they are only talking, they're not engaging physically. And so the dispatch team, again, would need to be really well trained at determining, okay, is there a component of this that needs a Met response, or is this a person who needs to have a conversation to de-escalate, and then the behavioral health unit would be the appropriate responder?
But physical abuse could be happening without anybody saying it on the telephone.
Exactly. So there are, that's the question of dispatch and training and having people know kind of the questions to ask. MET will still be an integral part of the overall continuum of service. This is not a replacement for MET. This is an addition to. So kind of expanding, we've got our social services that you all, help us, get in place. And then we would have a team like this behavioral health unit and then MET. There are certainly times where the presence of, a law enforcement officer with the clinician to help de-escalate situations and make sure everyone stays safe are warranted. And this just gives us another option that just looks at kind of strictly mental health without the law enforcement involvement. But yes, it will be important for us to have those conversations and a lot of training and education.
Yeah, it's amazing.
Among dispatch.
But a favor, please, a new name, but not cahoots. It needs a new name, but not
There's no
not
name
cahoots.
yet. This is just a descriptor, but we'll get there. You can put your PR brain on that one too.
Thank you.
Just to follow Commissioner Meltzer, if the person that calls is not the person who needs the service, then you're creating a different set of problems. Because the person who calls, say, it's the husband who's like, say, has been moody and thinking about ending his life. There's been financial difficulties, etc. So the wife calls. Now the team shows up. The husband's not interested. There's no buy-in for him. In fact, he may actually get worse. So I'm not sure who you want to call. You want him to be the first person to call, or do you want the wife to call and say, look, this is a problem I'm having, and what can I do, and who can you connect me to? Is that how this is kind of working? And the team doesn't show up? Or, I mean, I know that there would be a divorce. I mean, I've experienced things where people are not impressed with their problem become public. So my question, I think, is who is it you're interested in calling? You want the person to call, or do you believe that the wife should call and say, I have this problem and we can come and we can talk, but it might actually make the problem worse?
Yeah, definitely. That's a great observation and question on how will the team navigate those types of situations. And I would say that if there's somebody who's at risk of harming themselves or others, a call for services, whether that be 911 or the potential number in the future, that is the person who's the bystander calling and observing this. I would say the recommendation would be to make the call and have that opportunity for the person in crisis to be engaged, to see their significant other engaging with services. So definitely it's complex in relationship dynamics, and bringing in help to prevent someone from hurting themselves. I'm speaking also as a clinician myself, and a mandated reporter when somebody is expressing the need, that bringing in the help and then dealing with aftermath when they're still with you is the best path.
And I'll just add on to that, Chair Davis, that we don't have a preference for who calls. That's not kind of built into the structure of the team. But in some cases, the structure that is being used with 988 and DD Hirsch is that there would be initially, there could be a phone consultation too. So nobody would have to come into the residence initially if it wasn't a harm to self, it was just somebody who was moody or down and had been experiencing some challenges. There can be some initial consultation by phone. And I think looking at those kind of situations, that's kind of the ideal of what this team would look like. If there's an immediate crisis, this team can help address the immediate crisis. But then there's that really direct, warm connectivity to our agencies for ongoing support and care, whether that's for one or both partners in the scenario you described, so that there can be ongoing assistance outside of the crisis, the moment of specific crisis itself. So all of those things would be true. There could be, no team would have to necessarily show up at the door if that's not what's warranted. There could be some initial consult on the phone and then connectivity to other services as well. So it will depend on each situation and what the urgency and the level of crisis would be.
I apologize to my fellow commissioners for jumping in. Is there I have other questions, so I would pass my question for right this moment. I see Commissioner Byers.
Commissioner Byers had her
Yes,
hand up.
has her hand
and
up,
then
so
I'll go after
yes.
her, Chair
And
Davis.
so I
Thanks.
apologize.
That's
I
okay.
was actually just trying to follow Barbara, but I do have more things I want to talk about. So
It's
I will pass to Commissioner Byers.
Thank you, Chair Davis. It's a really exciting conversation, and I'm really excited to see this presentation. This just feels like sort of the future of care in a really big way, and it's really exciting to see it be pioneered here in our city. I had a conversation today with a friend who works in provider support for elderly communities who are like high risk, and she sort of explained to me this scenario where welfare visits are sometimes able to be handled by a mental care team, focused team. And then other times that care team says, it's 6 hours before we can get to your welfare check. And then, so she has to default to the sheriff's department. She said that today she was surprised because she had a really good experience with the sheriff's department where the officer didn't make her feel, as she said, like crazy for how she was explaining the scenario to the officer. And he was really diligent in follow-up and persistence. But what she expressed was sort of the exhaust that comes from having to flip back and forth. And so the thing that she was hopeful more than anything was the continuity of service. So it that was sort of the feeling of, this is a great idea, but if it's going to mean that it's only there sometimes and I have to sort of flip my brain back and forth in and out of services, that's one thing. And it's well, if this is the thing, if this is the right thing, I wish it had all the money in the world. And I know that's sort of not the reality on the outset. We have to prove and pilot and scale. But I just want to speak to that coming from, the words of somebody who's sitting in that scenario, who knows and feels like this is the right type of thing that we lean into, sort of resists having to go to the totally accessible default of the sheriff's department because it's not often adequate, frankly speaking. And so I just want to be a voice for continued investment into these type of compassion driven responses because I think it's going to make a big difference in the lives and the broader space of continuity around these services, which is the care industry itself. And so many people who are out there having to do that exhausting work of flipping in and out of what's available to them. I just would really want to see a big vision put behind this for, wraparound 24/7, being able to reach people at all different levels. Because I think that's the sort of where we want to go eventually. So let's talk about it and think about it in those big ways. That would be exciting to me. And it was mentioned already, but that education piece just feels so essential. So much of the work that I came from was helping people think about alternatives to how to engage in community response. We often, when it came to homeless services, try to encourage 211, not 911. So I just think in whatever ways we can be championing a really robust education program. It's also just another opportunity to help people think about how to destigmatize everything that's going on and sort of think about a different pathway to caring for community members who are in need. So education will just be so beneficial in so many ways, and it should also be, bigger is better. And I just also want to name that I personally hadn't thought about sitting in that chair of being a dispatcher and what it would mean to also have to do sort of what I just described my friend had to do, of the switching back and forth of thinking which way to go. And holy cow, what a task. And it's just sort of an interesting person's role to interview and get information from and think about, how many scenarios are there where it's borderline. And in that borderline, I feel there's so many new realms where maybe this behavioral care unit itself gets expanded out to a different type of services where, you know, somebody with a badge and a weapon may not always be the right type of forward facing, you know, community or like funded entity that the city can send out. And so I'm excited to think about, you know, from that lens of making a choice about who and what is the proper type of response, what other types of responses we get to think about here. And just, you know, huge gratitude to everybody on the team who worked on this really amazing program. Thank you.
Thank you, Commissioner Byers. Commissioner Shandrick.
I also spoke in support to council of exploring this program and defining it out more, and there's certainly a lot to explore. I think we've had a lot of good experience with the Sheriff's Met team and Step Up's MIT team that are important to learn from. And of course, this is a larger program and more focused on non-emergencies and non-criminal activity. Of course, the devil will be in the details. And as this options are explored, I would just, the main thing I would just emphasize is that how residents could or would use this is always taken into concern. I know with Cahoots and some of the other programs, maybe about half of their calls do end up becoming about a homeless situation. So, and I'm sure that's going to be a large volume of these types of calls, but I think it's a very important opportunity, a service for residents and something that they can utilize, something that they feel comfortable with, something that they're aware of and have knowledge and can call for themselves, could call for a family member, could call if they hear or see their neighbor in crisis, in addition to the homeless community. So I would just really emphasize how this could be a critical service for residents, and to keep that in mind. And then, of course, as you're designing and looking at it, what everyone's been talking about, how the calls would be transferred to the appropriate team. I think the other big question is, if someone is in crisis, where do we send them? Who has an open bed? Who has what mental health professional has an appointment open, and how soon? So taking the call, filtering the call to the right team, and then that referral are the challenges I see, but I think it could be quite an essential and important program for this city.
Thanks, Commissioner Shandrick. I'd love to just lift up a couple of the insights that you provided and just share some findings that, you know, further kind of double down on what you're saying. One of the things that we would been able to check out in the last few days is a little more detail about a sample month for the fire department and the types of psychological related calls that they respond to when they come into the 911 system and they're triaged to the fire department. Even in just a quick look at the August numbers, I was very surprised to find that of the 25 runs the fire department did that were purely related to psychological distress or psychological crisis, 20 out of 25 were for people who were housed, and 5 were for people identified as experiencing homelessness during the call. So definitely want to kind of lift up that idea of that we really want to make it clear that the behavioral health unit is here to respond to residents and people visiting and people going to the businesses or working in businesses, that they have the capacity to deliver quality services and hopefully kind of be able to convert people who may be supported by the fire department, for example, from that, you know, quick, small sample size, and instead helped by the behavioral health unit. So I just wanted to share that data piece, and thank you for your great feedback.
Anyone else? Commissioner Freiberg.
Hi, Elizabeth and Corey. Thank you for your presentation. I think this is a long time coming for this. Adding another first responder, I mean, this is huge. This is a huge thing to take on, and I think it's amazing. And I thank you both for bringing this to the commission. I had a quick question. I know Commissioner Meltzer had mentioned that there were 22,000 calls for Cahoots. Was that, do you know how many that was out of, like all the calls that they get in general? I'm just
No,
trying to
it was just a statistic when I went on their site. And then I looked at their population. You may have it there. I don't remember where I saw it, Elizabeth. Maybe it was on their site or maybe in your material, but it said 22,000. And I assumed it was a year for that year.
Yeah, 22,000 total calls to Cahoots.
Right.
In it was a 1-year report, the most recent report that they have available. And the population is larger. It includes Eugene and Springfield.
Okay.
One has 176,000 people approximately.
Okay. I think everybody else pretty much covered a lot of my questions. I just hope we're mindful of what these vans will look like, you know, when they're pulling up in someone's neighborhood, you know, like a family might not want this van coming into their neighborhood. It might be embarrassing. They might not call because it might say something about mental health services. I know I was looking at the Washington State site and they had on their vans, it said building healthy neighborhoods. So I just hope that we're mindful of what these vans are going to look like, you know, because I don't want it to, you know, like, let's say you're a mom and you're with your family and now the whole neighborhood knows that somebody in your family is having a mental health issue. They might not even be having a mental health issue. It might be something else, you know, behavioral issue, you know, but I just want to throw that out there.
Thank you.
And thank you for your presentation.
Patrick, I see your hand just shot up for a second, so go ahead.
With Commissioner Freiberg brought up a good question about, of course, about branding and all of that. And I know you've spoke about a wellness team and kind of having that more proactive, but I also to the numbers. And I read an article about the Cahoots call, and there's a little bit of question how many calls Cahoots relieves from first responders. Some people say it's about, they take 20% of the calls from the police or fire department. They reroute them to the Cahoots team, which is, you know, that's substantial. The police department says, well, if you look at calls that they would take, they don't take all calls. They have obviously a process of screening. Cahoots maybe takes over 7% of the calls. So though in your research, as I said, the devil's in the details. I think all that call volume and thank you, Elizabeth, for the synopsis of just the look at the fire department's calls in August. I think those kind of numbers are very important in designing this service.
Yeah, I definitely appreciate that. And we want to be looking at how this team is able to enhance and expand what the community sees as like immediately available responder, and it not being a one-for-one. The behavioral health unit can now take this off of the fire deck, or this can now come off the sheriff's deck. We don't know what that will look like, and we also just want to really see this as an enhancement to the program, without advancing kind of like a 20% of the budget can now be covered by the behavioral health unit. Just as you said, the range, even in the Cahoots model, the report and that's produced by Whitebird Clinic and the fire or the police department together is estimating it around 7%, and that the Cahoots model responds to a much wider variety of calls than would come into the 911 system, even though right now society tasks our 911 system and police with a very large portfolio of social service activities integrated into their law enforcement capabilities. So thanks for that insight and just continuing to lift that up.
Oh, yeah, I muted myself without noticing it. When you have the proposed scope of services, I noticed that there's no service for abuse. And is abuse, domestic violence or domestic abuse, still would be a 911 call, even though those are the most dangerous calls they make. So where does abuse still fall under the other purview, or could it fall under this purview?
Right now, the recommendation is to, because domestic violence has the element of harm involved, that it would be appropriate to still have the law enforcement and potentially the co-responder model addressing those situations. But with that being said, and there are legal components to domestic violence situations, and that even in those situations, what's good about in West Hollywood is that those could be linked to longer term supportive services through our existing contracted social service agencies, depending on the needs of the duo or the dyad that might be experiencing interpersonal violence in their relationship. So right now, the recommendation from what we have researched is to continue to expect law enforcement to be involved in violence.
Okay.
Yeah.
That answers that. And then I had one comment, and I can't find it, but I know that I saw it up there. And that was an actual brick and mortar location pending. The word was pending. Now, that brick and mortar location has been asked for a long period of time by the Social Services, Human Services Commission for our social services agencies. So if this particular program gives me or the city, and sometimes I use me as the city, the actual brick and mortar location inside the city of West Hollywood, I think is very important. And it has been important for a long, long time. And I don't believe people listen, or they're not interested, or they just think it's too expensive. But if we can afford this, then we should be able to afford a brick and mortar location for the social services to work out of. And that's my last plug for that. But I've heard this for the last at least 20 years. And no council has ever taken it up, and no one's ever really gotten serious about finding the location as we lose more and more social agencies, service agencies within our borders. When I first started, a good percentage of the social services agencies were within the city of West Hollywood's borders. I know that's probably a surprise, but that was true. So I think that's a very important component. And I don't know, you can't really say anything because you can't pull it out of your hat, but
no, we can't.
I want to know who you want me to pressure, because I've been trying to get pressure pointed that way for a long period of time.
Well, we'll steer you in the right direction at the right time, Chair Davis. That is part of the work that's outlined in the city's homeless initiative, the 5-year plan. And that is part of what we have begun, a feasibility study for locations in West Hollywood for an access center, interim housing and permanent supportive housing, primarily to address homelessness. That's funded by Measure H dollars from the county. And we're in the beginning stages of that feasibility study. But certainly, we're hopeful that if we can find some success in accessing some space like that, that could be a potential home base for a team like this, in addition to the other goals of service delivery on site that we might have. But we will definitely be coming back to this commission with updates on that feasibility study, and we'll have more information about some public meetings that we're going to be having and community engagement. We're still at the beginning stages of that work.
Cool. Otherwise, this is really an excellent idea. It's an excellent presentation. And I agree with everyone that it's been a long time coming. And it's unfortunate that it doesn't already exist here. but we can get it here. So good luck. If there's anything that I can do to help you, you be sure and ask me, or any of us, but we will be glad.
Just hurry up, Corey.
We will.
I'm sorry. Oh, pony up for it. Yeah, exactly. I'll leave it.
We're working on that too.
Okay.
Can I just ask one more question?
Yeah.
Before we go? I just wanted to know, so let's say there is a scenario, it seems like a lot of people are saying, well, who do we call? Who do we send? Is there a downside to just sending them along, with the fire department, let's say it's domestic violence call? Why not just send them with the fire department or the police or whoever are the first responders? Is there a downside to that? To just, like another safety net, just throwing it in there?
I think that's a great question. And definitely the idea of how many different opportunities can we get to get people connected to services that stabilize them. One of the things we picked up from the way that Cahoots reports out on the way that they interact with the law enforcement teams there is when the team is in the field. So if in theory, if West Hollywood Sheriff's was responding to that situation, they would arrive on scene, and once the immediate kind of engagement has been contained, they would also have the ability to do kind of internal calls for backup from the team. So like the Eugene police will sometimes call for backup for Cahoots to come out and provide supplemental crisis stabilization services. So that could definitely be a part of the design, and we can note the idea of calling for backup. And the same goes for what we've seen with the Cahoots model. Most of the time, the just like overwhelming majority of time, they don't need to call for law enforcement backup. That also probably indicates that the dispatch is well done and in terms of assessing the situation. But Cahoots does seem to have a very low rate of calling in law enforcement for backup. So it seems that law enforcement may be more likely to call in a behavioral health unit for extra services.
Okay, and sorry, one more question. And is their response time the same as, let's say, someone from the fire department or police?
Yeah, so that would be the exciting enhancement, would be the idea of this team is as capable of responding within minutes as fire and police. And those systems are extremely well resourced in order to be able to do that. So to create a third option that can be just as functional really speaks to how necessary long-term resource investment is going to be to ensure that there's significant or sufficient staffing and units that can respond. So thank you for calling that out as that's something that would be ideal.
Yeah, I mean, that's so exciting. That's why I think this is just such a great thing and that's, for lack of better words, to bring to West Hollywood. And thank you both for working on this. And like Chair Davis said, just let me know who I need to talk to.
Thanks. Yeah, and we definitely want to call out the collaboration across many divisions that are involved here in terms of working on this in-house, and also our here with social services. We have our team, community and legislative affairs, that are tracking legislation in Sacramento. So not only is there are West Hollywood staffers looking at internal projects we can control, but also how can we influence broader systems to enhance the well-being of our community. So it's that cross team work with public safety and conversations with fire and the sheriffs that is really making it possible for us to bring kind of even this level of kind of analysis to the table is through that lift across our teams. So we're happy that we can all collaborate on this and bring it to the community and commissions to get feedback and keep the momentum going.
Well, thank you very much. You guys, both of you remind me of why I live here and why I love living here. So thank you very much for your presentation. Thank you all commissioners for good questions and good observations. And I would like to continue to move the meeting along. a little bit here, just in case there's somebody who might want to do something else during the evening. I'm going to skip to tonight. I'm going to skip to items. There was no excluded consent item, so we'll move to items from staff, and that will be. I turn it to David, or do you have for the COVID?
So yes, I'm going to provide the update on the utilization of West Hollywood emergency funds in response to the COVID-19 pandemic. The report I'm giving you this evening is reflects data as of August 27th, 2021. As you are well aware, the following 6 agencies have provided services to the West Hollywood community in 3 main emergency service areas: eviction prevention and defense, rental assistance, and emergency meals. Those 6 agencies include Bethesdic Legal Services, the Coalition for Economic Survival, the Alliance for Housing and Healing, National Council of Jewish Women, and Project Angel Food. So the 2 agencies that have provided pandemic-related services to West Hollywood community members related to eviction prevention and defense are Bethesdic Legal Services, which has received to date $188,658 in emergency funding. They have taken on 154 clients. They have resolved 117 cases, and we are taking a recommendation to extend that program through March 31st, 2022 to council on September 20th. In addition, the Coalition for Economic Survival has received $60,000 in emergency funding from the city. They have held 35 weekly legal clinics. They have brought on 133 legal clinic clients. They have held 8 eviction moratorium education workshops, and they have proactively outreached to 630 outreach clients. That program is funded through March 31st, 2022. The rental assistance programs include the Alliance for Housing and Healing. They have received to date $308,820. They have provided 307 grants. That breaks down to 103 first round grants, 82 second round, 57 third, 41 fourth, and 24 fifth. They have in remaining funds $67,942. The National Council of Jewish Women, they have received to date $1,576,201. They have approved 1,588 grants to date. 478 of those were first round, 430 second, 379 third, 211 fourth, and 90 fifth round grants. They have remaining funds of $226,608. Wanted to highlight that the state, hopefully many of you know, the state has their own rental assistance program called the California COVID-19 Rent Relief Program. It's referred to as Housing is Key. This program assists income eligible households pay rent and utilities both for past due and for future payments. They will also assist eligible folks with utility assistance. You can go on their website and get the, they have a dashboard of applications according to municipalities. For the city of West Hollywood, as of August 31st, they have received 1,066 applications. Of those, this is an amazing stat, of those 1,066 applications, 1,063 were complete and are being processed. The total amount of funds requested is $16,418,567. They have processed, out of that 1,063, they have processed 556. It's about 52% so far. The average amount of assistance provided is $16,045. They have paid out so far $8,920,904. That program, everybody, that's still accessible. You know, if you know anyone who has not accessed that program, please, encourage them to do so. And that can be, they have assistance for both the tenants and the landlords. So if the landlord can apply for back rent owed, and if the landlord doesn't, then the tenant can get in there, applied, and make sure that back rent is paid. They will pay 100% of back rent back to April 2020 through September. And then they when they mention future rent, they're actually talking about July, August, September. We're all waiting to hear what's going to happen with the eviction moratoria as of the end of the month. All indications right now is that it will be lifted, but I encourage you to attend the September 20th council meeting to get the update on that. And then finally, Project Angel Food continues to provide emergency home delivered meals. They have received $328,254 from the city in emergency funding. And then they received $138,241 from CDBG, that's Community Development Block Grant. They had their own version of CV COVID emergency funding. They have provided emergency home delivered meals to 165 West Hollywood community members. They've delivered 51,051 meals. And that program currently has remaining funds of 11,495. And that's my update. Recommendations for emergency funding and an update on the eviction moratoria, as I mentioned, will be going to council on the 20th. And then any other staff with updates? Les, Joan, Derek, Katie? With that, we turn it back to the commission.
Awesome. Okay. Moves to public comment, ending public comment.
No, Chair, there is no public comment.
All right, thank you. And go to items from commissioners. Any commissioner want to volunteer to go first, or yeah, okay. Commissioner Shandrick, I saw your hand first. Go ahead.
Just real briefly, I've to also follow up on what David said. I've been attending some meetings and around the California COVID rent relief program, and also throughout the county. Just have to highlight that there was a little bit of a slow start, but they have really put everything behind this. People applying are getting notice quite quickly if their application has been approved. Money is going into bank accounts. The money is flowing, and I think the program is really operating in the way it is intended to. So I will just echo David's comments. This is so critical, and money is still available. I think the program will run till hopefully every penny is spent. So it is really a key to providing housing stability at this point during the pandemic. And so I was just glad to see the program working so effectively. That's my update.
Thank you. Commissioner Shandrick, Commissioner Meltzer.
Thank you. David, I don't know, my LACOA commission had a talk by Dr. Paul Simon, who's the Chief Science Officer for the LA County Public Health Department, and he gave us a great update about COVID-19, and he sent us his PowerPoint presentation, which I would like everybody to have. And David, did I send that to you so you can distribute that? And if not, I will send it to you because he had wonderful, wonderful information.
You did, and I apologize.
Oh,
yes,
that's
you did,
okay.
And I'll get it to Dee to send out tomorrow.
Okay, because I think it's really interesting and very up to date. And then to take us all down a notch, way down a notch, Kamiko, I spoke with Kamiko, who runs the wonderful, wonderful AWE program for JFS. It is art and what is it? Art,
well,
help me with
wellness,
this. Wellness and engagement. Anyway, I contacted her and I suggested that she have improvisation classes. And I found an instructor for her. And so anybody who is 55 and over here in West Hollywood can take her improvisation classes. I'm very excited about that. I will be doing that.
I've been in improvisation mode for like 66 years. Just making it up as we go along.
Anyway, it should be fun.
Yes.
It should be fun.
I agree. Any other commissioner? Commissioner Darvish.
I wanted to wish everyone safety and great health as a healthcare professional for 40 years, with the pandemic still in our lives. Just to let you know, I'll know that, you know, in the hospital industry, that meetings that I sit in, it is so hard to see the staff at the bedside really giving it all and trying to take care of all. They don't discriminate if you're vaccinated or not vaccinated, but it's just tough for everyone. And they're burned out, they're depressed and tough. So I wanted to thank all the healthcare workers for being there, including the doctors, and from all levels, from bedside to housekeepers to people that prepare food for them and clean the rooms and all of that. So just wanted to wish everyone safety and in hopes that we get through this soon and put it behind us. Tough times for everyone.
Commissioner Byers.
Thank you. Thanks for all the presentations tonight. David, I especially appreciate you helping us walk through the budget update. I had a lot of questions that I was going to be asking, and you just sort of anticipated every one of them. So big appreciation to you in recognizing the newness of some of us on this commission still. I also just wanted to thank the anonymous staffer who was able to help another one of my friends who contacted the city, anonymous because she doesn't remember the name, and maybe somebody will remember the story specifically, but she had reached out looking for support in a really tough situation where somebody had a number of pets that she didn't want to leave in order to get checked into the support that she really needed. And Paws LA was there to do exactly what they do so well. And it was just a really great linkage. And she followed up with me to let me know that it all went so well, and was really appreciative of the city for just like, you know, oh, this is who does that in here, so you can contact them. Just one of those constant surprises at how easy it is to reach the support you need. And so it's always like, I don't know, I just find people in that panic mode, and how easily we are able to sort of alleviate their panic and give them exactly what they need. I just wanted to share a big appreciation, since, you know, it is tense times. It does feel like less and less. It's there's a helping hand out there, a friendly face. I just feel like that's what we're here to do, is provide that type of support. And I'm really feeling the power of this after watching all of these new contracts get approved. And thank you all for being a part of this.
Commissioner Freiberg.
I would like to say I look forward to getting this behavioral health crisis unit up and running as quickly as possible. And I want to commend Corey and Elizabeth again for bringing this to our attention. And I hope we stay on it, which it sounds like we are going to be on this. So I'm excited about that. What I spoke about earlier, David, you had mentioned that I should mention about JFS and their meal delivery service, if we get a report on their nutritional values and all of that. And then I wanted to ask Derek, because he had given us a update on fentanyl a while back when I was on the Disability Advisory Board. And I was wondering if maybe we can get an update on that, how it's affecting our residents in the city. I don't think I've heard anything really recently. So maybe if we can get an update on that, that'd be great. And that's it.
Yes, sounds good. I will do that.
And would you want us, Commissioner Freiberg, as I kind of alluded to earlier, would you want us to bring a comprehensive report on all of the home delivered meals and congregate meals, looking at the nutritional value, looking at the way that they put together their meal plans? So we would do JFS, Project Angel Food. Seeds of Hope aren't really meals, but I think it might be good to have that included. So would you want kind of that comprehensive?
I think definitely adding in the others. I mean, I think I just, JFS, we're giving them almost $500,000 to do this. So I think that's a pretty big deal. But yeah, I think we should, maybe ask Project Angel Food as well and the others.
And Commissioner Chair Davis, is that the will of the body?
I believe it's the will of the body. I would also agree that your example in the report for, like, say, one similar service, similar does not necessarily mean equal. And so it would be interesting to see. And I agree with Commissioner Freiberg. So I don't see anyone shaking their head vehemently against it. So yes.
Great, thank you.
Commissioner Palmieri, Vice Chair.
Thank you. I just would like to acknowledge National Recovery Month. I know that it was on consent calendar. This is a month that really hits home for me. Of course, as you know, I'm friends with and know many folks that are in recovery, that may not be in recovery, that may have relapsed. And this is a month that I get to reflect on and look at the last 19 years, I guess, of folks getting well and enjoying life. And, you know, some fall back and then they come back again. And unfortunately, we do lose a lot. And you know, it's what I call that's the icky part of it. Sometimes people check out and we don't see them again, and that's just part of it all. I'm really happy about the city requiring Vax ID to get into covered businesses. I think that if that was done, this is my opinion, if it's done for the next 3 months, we might be able to curtail infections and to save businesses that are dying. Because of the pandemic, I received my third vax because if you remember, I got my first about 8 months ago. I was one of the first weeks, and I got my third. And you know, I didn't have any reactions to the first two, but the third one, I had like racing dreams, like just fast dreams. And I went on the internet, and it seems to be a common thing. It lasted like 2 days. I did read something about fraudulent ID cards. The Department of Justice has determined that they are or could be a federal offense, $5,000 and 5 years in jail. And there's a woman in Arizona that actually is in jail because of this. So I think what the city will be doing is going on the code on your telephone, so that the cards will be, you know, maybe one method of use, but the code will actually be for you. I've gotten so many texts while we're on. A lot of people must be watching tonight of "I love you, Jimmy," support, blah blah blah. I just don't know what could have triggered that, but whatever it is, I'm just really happy. Thank you.
Excuse me, is there still time for public comment?
No.
No, sir. The public comment part has passed.
All right. Anyway, thank you guys.
You're welcome. The only thing I have to report, other than this has been a fairly good meeting, and thank you very much for the behavioral unit. That's like a thumbs up. David, I need to, if there's a way that I could get last year's numbers next to those numbers, it would be nice. Maybe before another meeting, so I can just kind of see where it is that you're going. If that's a possibility and it's not too much work.
Absolutely. I can always send last year's report that will have the funding from the current year, the 2020, 2021.
Okay, I'm sure I have it somewhere, but it would
Okay.
be easier if you just sent me an email and had it on it.
Yes.
And finally, I would like to adjourn the meeting until October the 12th of 2021. Thank you all very much. Good night.
Thank you. Good night, everybody.
Night.
Thank you.